McFarland. I'm the project coordinator for Project AWARE Robertson County. Project AWARE is a 3-year federally funded grant. Project AWARE stands for Advancing Wellness and Resiliency in Education. It's a national project, and we are the only county in Tennessee who has a community-based grant. We'll be working over the next 3 years to bring youth mental health first aid to 1,100 Robertson County parents, teachers, school counselors, bus drivers, Cub Scout leaders, youth leaders, anyone who works with youth or who has a youth from the ages 12 to 18.
Part of it is a reminder of what typical adolescence looks like. We know that adolescence can be a roller coaster, and sometimes some of us older folks forget that, so it's just a reminder about that. And then we actually give folks practical skills and an opportunity to practice those skills in a safe environment before they really need them.
I am supervisor of counselors, and that's one of the reasons that I wanted to be a part of this training, to see if it was something that would be applicable for them.
I deal with so many juveniles, so many families, so many issues, and often the underlying issue is mental health or some type of adverse childhood experience.
Well, I have worked with Melanie in the court system for the past 8 years, and also I've got a granddaughter coming into that age, and I'm in the schools a lot with her and see these kids, and our suicide rate in this county is way too high for our children.
The presenters were fabulous. It was so non-threatening. No one was targeted, no one was embarrassed of what they didn't know. This was a terrific learning experience.
I enjoyed watching my colleagues, Department of Children's Services, caseworkers, other attorneys that are appointed as guardian ad litems, my staff included, get the knowledge and be equipped with some skills to help these families.
I thought it would be great, especially for teachers and professionals that deal with young people on a day-to-day basis. Especially, as a matter of fact, I would recommend it to any church groups.
It was very informative as far as everyday language to use with kids. I just felt like it gave you the everyday skills you needed to approach a youth who's having these mental health crises.
Because most kids just want you to listen. They don't want you to give suggestions. They don't want you to, just tell them what to do, but just sit there as a non-judgmental friend.
What we had learned within that class and how to approach, how to embrace the myths, the facts, the engagement of those persons in that class with one another. Once again, coming back to those presenters, it was dynamic. Those were training tools that was in this training that you just can't sit on that type of information. It's an automatic act.
You're not necessarily going to know everything to say, but if you've practiced it over and over in a very non-threatening atmosphere, which this training is very non-threatening, I looked across the room and I saw every type of person, from a elementary teacher to a high school football coach, and everybody in between.
But we have so many. I mean, on a weekly basis, we're taking kids out of our elementary schools. They're having to go to the hospital because of self-destructive and suicidal tendencies and things like that. I think we've got a chance to save lives, save families, save relationships.
Hopefully it will erase some stigma that is so prevalent in mental health, especially with our youth. So many adults, parents, don't want to admit that their children need help.
When you train that many people, and that many people have access and to the content that you all are giving, then all of a sudden it creates this empathetic, view of each other that says, I truly care about what you're going through. And when you do that, then all of a sudden, instead of a lot of people that automatically want to talk, you have a lot of people that automatically want to listen.
I think it'd have a very profound effect in a positive way on our community. I think it'd be a very profound effect because I think we have a way to fix families. We have a way to prevent suicides. We have a way to get the people the help that they need so they can become productive citizens. Most people with mental illness can be wonderful, productive, loving citizens like everyone else. They just need some help.
People in Robertson County care, and oftentimes that's the best place to start. Let's start with a caring heart, and let's give folks some skills.
So as you can see, we're really excited to be able to bring the Youth Mental Health First Aid training to Robertson County through this project. And we know that we're already making a difference, and we hope to see you in class very soon.